Hey guys, it's Dr. James Hint. Today we're going to do a total ingrown removal. Okay, here's why I like this video today is because if you look at the right foot, okay, this has been completely removed. This was removed sometime, when was this removed? April? So this was removed April. Look how it's completely cleared up. To me it looks good. Okay, now we've decided we're going to do this one. She wants to have this one removed. But here's kind of my joke with my patients. I tell them, look, when you're 85 years old, you have Alzheimer's and you have drool running out of your mouth, you're in a wheelchair and you're in a nursing home, you'll be so happy you had a thick fungal ingrown toenail removed. She'll never have to worry about this ever again in her life. So I'm a big fan of removing onychomycotic or gryphosis with toenails or pincer nails or chronic ingrown toenails. In her whole lifespan, she's a young woman, so she's going to have a lifetime left. And with things like this growing in the corners like this, and it's thick, dystrophic, she would be so much better off just having it removed. And believe it or not, this is a little bit tougher. When you burn this out with your laser, it's a little bit tougher on the skin. She could actually take some toenail polish or fingernail polish, actually polish this for a party, and typically this would look better than this. But we're going to go through the procedure first. I'm just going to number up right here. Typically you just have this right here to where you don't even have to watch. I remove it completely and then I'll laser this out, and then after a couple of she'll have a wound there for about a week and a half. And then after that, the skin will grow back, it'll look normal, it'll look healthy, and this one right here will look just like this one. But I'm going to show you this today, but I think you're really going to enjoy the video. If I get to the point, I have a running joke with my patients, when I turn 65, I'm going to have all my nails removed. And I know that sounds kind of like a joke, but if my nails start to get thick, dystrophic, I'll have them all removed. I would love it if I had 10 toes that look like this, because I will never have a problem with a toenail ever again. Okay guys, here's what we're going to do. We use a small sterile rubber band, and then we put it right here, and you have to have it a bloodless field. So this makes it a bloodless field. So she's already been given a numbing medication with, I like to use 1% lidocaine plain without epinephrine. So what I like to do, I can either remove it with a small hemostat. Usually when I'm removing borders, you'd remove it with this small hemostat either here or here. This is called a platypus puller. And if you look at these look pretty mean right here, but she's completely numb. She won't feel any of this, but this is a platypus puller. It kind of looks like a duck-billed platypus. And what we have right here, I use a small little elevator here, and you just go into the side here, and then you go into the side just like right here, and then you go directly on it. And if it starts to bleed a little bit, you just take your little gauze, and then what you do, you have this, and then you stick it in the side, and you go directly deep, and then you roll it counterclockwise on this one. So you just roll it counterclockwise just like that, and then you'd roll it up like that, and it completely frees it. So if you look at this right here, it looks pretty good. Now, if you look at this, so on the back side, fungal and thick, and it's starting to grow in a pincer nail formation. Okay, so got that right there. And then what I'll do, I'll just pick off this little bit excessive skin right in here. In just a second, it'll stop bleeding. Okay, but you want to have a bloodless field to get everything off. Okay, so you just take all the excessive skin off. You have to pull it just like that. And sometimes you have to take it just like this. So here's what you do. You just take this directly on here. Much better. So if you compare one to the other, got that one, and it'll heal up over time. Okay, but now the next step is you have to kind of grind this out a little bit. So you have to take this root and make sure all this has come out. Okay. right in here. You're actually pulling it all out. But it looks healthy. Okay, so now what we do, take this, and you have to do several of them, but that looks real healthy. Okay. And then you just take them directly in, just like this. I'm going way directly into that root. And that acid will cause that skin to discolor, but the discoloration will pop back and become normal in time. So she'll have a wound there for about a week to a week and a half. Okay. Starts to turn the skin a little bit white. Yeah, it's starting to look real good. The main thing, you got to get underneath that root. If you don't get underneath that root with the acid and the laser, you've got a good chance of it coming back. But you can see we're going way deep under there, so she shouldn't have a big problem at all. Okay, so now let's use a laser on this, and then we'll call it good. And then right here, you kind of have to pull the skin back right here when you're doing it, directly in like this. Deep in there. And what I might do is down in the bed, go several times here. And I weld. I have a MIG welder, I have a TIG welder, I have a stick welder, and you do it like you're stick welding. So you have this. Now, if you're just going like this, you have to do a pattern when you're going kind of a circular pattern. Okay, so all you do now, put the wound gel directly in it, just like that. See, it's already starting to look pretty good. And then put this directly on it. You take this off, pop back, and then put this directly on it. You have a wound on it for about a week, week and a half. It'll look good. I usually like putting them tight. One of the complaints is I put bandages on too tight, but I don't want them to have any bleeding afterwards. But this should look really, really nice when it's all said and done. Okay, guys. Thanks for watching. Have a good day.